Mauna Kilohana Kalani Pe'a this morning. That's music from his newest release here on 93.5 FM. Hey, we want to welcome to the show on the phone line Lorilee Watt, nurse manager, Obstetrics Department at Maui Health, here to talk story with us on the Aloha Morning Show. Good morning, Lori.
Good morning, Shane.
Couple of questions this morning, Lori. How many support people can you have with you during labor and delivery at Maui Memorial Medical Center? And are there any specific restrictions or guidelines for those support persons?
This is a great question, Shane, and one that I get asked quite frequently. Mm-hmm. As you can imagine, Maui is a tight-knit community,
yes.
And of course, everybody over here. Because our unit specializes in obstetric care, our visiting hours are just a little bit different from the Maui Memorial Medical Center visiting guidelines. We have also updated these guidelines, so happy to report that you are getting the most up-to-date information. While in labor and on the labor and delivery unit, you can have one primary support person with you, and this is a support person that will be with you during labor and during the recovery on the mother-baby unit. In addition to that primary support person, you are also allowed one additional visitor. So this will total 2 visitors. Now, sometimes our moms request to have a doula, which is a trained labor support individual. And if this doula is certified and has made arrangements with our unit prior, then they can also visit with the patient for a total of 3. I think one of the most important items to remember is that no matter who you're having visiting, whoever your 2 support persons are, it needs to be the same 2 support people throughout your labor and delivery process. This is because we are a very busy unit, and we really strive to provide exceptional care to our patients. And having this guideline allows you to have the support that you need while also ensuring a safe and comfortable environment for everyone. There are also a few other important things to keep in mind. While you can have 2 visitors during labor, children 13 years of age and under are not permitted in the labor and delivery rooms. They can come visit over on the mother-baby side after delivery, but definitely not allowed in labor and delivery. And this is just to ensure safety and focus needed during the birthing process.
Yeah, of course.
Now, after the delivery, this changes just a little bit as moms and babies are transferred to our mother-baby wing. It's right across the hall. Mm-hmm. I'm sure it will come as no surprise, but newborns tend to do things on their own schedule and on their own time, and our moms and primary support persons need to adapt to this new routine. As rest is so very important for recovery after delivery, we observe what we call preferred visiting hours for all other visitors. And these preferred visiting hours are from 10 a.m. to 8 p.m. It's very important that visitors respect these hours to allow our moms and babies all the rest and bonding that they need. If you have any other questions about visiting hours, you can check those out at mauihealth.org/visitor.
Lori, this is an interesting question. What newborn screenings or tests will be performed after birth?
Okay. Again, great question, Shane.
Yeah.
So some newborn screenings are required by law in Hawaii because they are so important. Mm-hmm. And it has been proven that early detection of possible disorders are essential for optimal childhood development. At Maui Memorial Medical Center, our OB and PEDS team want to ensure that you have peace of mind before discharge. And so after your baby is born and after you have bonded with your baby, a few key tests will be done. First is the newborn metabolic screen. And this checks for, they just updated this now, so it checks for about 37 different genetic and metabolic disorders like sickle cell disease and thyroid issues. So what happens is we'll take a small blood sample from your baby's heel, and we collect the sample and send it to the lab for analysis. We'll also do a hearing test to catch any early signs of hearing loss, which is crucial for early childhood development. And then we also check the baby's oxygenation level. And these are all minimally invasive and takes about 5 to 10 minutes away from the bedside.
You know, Lori, I'm listening to you and I'm like, man, you guys do a lot of work for our babies, for our mothers, for our families. And we just want to thank you guys, Lori, for all of the great work you guys do there in that department, because it's such a life-changing experience, you know, when a baby is born and a family is increased. And, you know, you guys are right there. You're the first persons that, you know, make sure that happens. And I don't think you guys are thanked enough. So I just want to thank you guys, Lori.
Shane, that is so sweet. Thank
You're
you
welcome.
so much.
Of
And I want to say, you know, we're all here on our OB unit because we love what we
Yes.
do, and we love our community, and we love our babies.
Yes.
So, yes, thank you.
Well, Lori, it was nice talking to you this morning. I know we'll talk again. You have a great day, okay?
Thank you.
Aloha, Lori.
Uh-huh.